it's already been proven, like some really big brains like Buffett and Diamond and those guys, and Bezos, they tried to fix it, right?
Yeah.
I don't think it's possible. So I think what we need moving forward are people who have a deep understanding of a little space,
Yep.
like I do of spine surgery in the spine business, and create a solution for that space.
All right, guys, I'm sitting here with Jamie Rindler, the founder and CEO of Marvel Group. How are you doing, sir?
I'm doing well. How are you, Spencer?
I'm doing well. Thanks for coming in from South Lake, man. I didn't realize we always put DFW right on our profiles, and that could mean you're an hour and a half away. So I do appreciate you coming in, man. Commute was okay, right?
Yeah, thanks for having me.
Yeah, it's my pleasure. We were just talking about off camera how we got connected, and it was kind of one of those odd things through LinkedIn where I saw you post on Josh Butler, who is a really well-known, actually the Benefits Pro Broker of the Year in 2022 in West Texas. He's a West Texas broker. I saw you comment on a post, and I'm like, that sounds really interesting. And so I reached out to you and said, hey, would you talk about Marvel Group on the podcast? And you said yes, and here we are, man. Yeah, it's funny, the beauty of LinkedIn, the power of LinkedIn, right?
We started, I really just got on the LinkedIn platform maybe a year. Well, I've been on it for a long time. I got serious about it about a year ago, and it is amazing, isn't it, what happens when you get out there on LinkedIn in the business world.
Well, I saw you at a post, maybe it was a couple months back when I was going and checking out your profile and I'm thinking about things to ask. You had a really good post that just sort of summarized everything about your business, which I love because I actually copy and pasted it onto my notes here. I was like, that's a really excellent summary. It helps me with my questions. But it's good like that you can use this platform. It doesn't have to be all business, but it does give you an opportunity to sort of talk about what you do, right?
Yeah.
Was there somebody that pushed you to start using LinkedIn, or how did you get...
Well, yeah, there's a gentleman that we talked about earlier, Matthew Ray Scott.
Yeah.
He's got a company called Feed the Agency, and Marvel Group and Feed partner to help promote our surgical stewardship program. And he is I call him a LinkedIn influencer. He's got like 10,000 connections plus, and posts 3 or 4 times a day.
Yeah.
And he encouraged me to get started, and I did. Now I've just been amazed at the results.
Well, so there's a guy in our industry that's more on the broker side. His name's Andy Neary. There's another gentleman that's really good at it, Ryan Miller. They're kind of different styles, different parts of the country, but kind of have a little bit of a similar business. And they're both strong advocates for LinkedIn. That's where I sort of learned the power of what to do, why to do it, the consistency component of it. And your I would say your profile, no pun intended, starts to grow the more you kind of show up and the more you talk, right? So I'm glad to hear you're using that. Again, that's how we got connected. And you brought this up, Jamie, so we'll go into this here in a moment. We're going to talk about surgical stewardship, which I'm really intrigued to unpack what that is. But I'd like to get some more of your backstory first, what brought you here today, kind of your history, family life, career. Yeah,
sure.
Tell me a little bit about you, man.
Yeah, sure. So as you mentioned, I live in South Lake here in Texas with my high school sweetheart and wife, Amelia.
Nice.
And our 6 children.
6? Oh, yeah. Wow. Awesome.
Our oldest is 22. He's now graduated from college. Our youngest is about to turn 12. So we've got a pretty busy household.
Yeah, I imagine.
But going back in time, I grew up in Ohio, in Dayton, Ohio, and in a family business, a contracting business. My dad has a 45-year-old landscaping business, and as I mentioned before, it made for a great childhood. He's an entrepreneur, and he would take me to work with him every day.
Well, you tell me that you were like 8 when you were doing this, right? So
yeah,
rather than being dragged to work, you said you really loved going to work. With your dad,
I
right?
did because I loved to like drive the tractors around and run the equipment and just hang out with my dad. And so it was a great childhood.
And that's where you got a little bit of that entrepreneurial drive, right? Is watching him, or was that?
Yeah.
You feel like you're born with it too, a little bit.
I think it's probably a combination of both. But he was a great role model, and so I grew up, and that was sort of my passion as a teenager. I played sports, but I also worked after school and on the weekends with my dad. And as I grew up, I thought that I wanted to take over the family business.
So you thought you were going to be in landscape architecture, right?
Yep.
Like, did you study it? Like, is that what you studied in college?
Yeah.
Okay.
So I went to Ohio State and I earned a degree in landscape architecture. So totally unconventional path for the medical industry or even insurance.
Well, I'm excited when we finally get there to where that connection point is. But yeah, so that's obviously something completely different than what you do today. This podcast is brought to you by True Captive Insurance, a premier medical stop-loss captive for employer groups ranging from 25 to 1,000 employees. True Captive believes in healthcare that is personal and insurance that isn't complicated. That's why they take a white glove approach, making it easy for employer groups to transition into a program built specifically for them. Check them out at truecaptive.com. This podcast is sponsored by PlanSight. PlanSight is a technology for employee benefits brokers to more efficiently manage their RFP process for any group size, all funding types, and over 20 benefit lines and point solutions. PlanSight is the only end-to-end RFP technology on the market today. Let's modernize your RFP process together. Check us out at plansight.com. What was it about that business or that space that you finally uncovered that you didn't want to do it?
Well, I literally broke my back.
Oh, literally?
doing landscaping.
No, literally now. And there's the connection. It's your back. Okay.
Yeah, and I ended up needing spine surgery. I ended up as a patient.
How old were you when that happened?
I was in my 20s.
Okay.
And
how did it happen?
I think it was just cumulative. It was lifting stuff the wrong way and too heavy for too long, and eventually a disc herniated, and I needed a relatively minor back surgery. In hindsight, I didn't know at the time that it was a minor surgery, but I ended up having it. I was in great hands, and I had a great outcome, and I was one of the lucky ones.
Do you think you had a great outcome because you were so young, though? I mean, do you think that's part of it?
That's definitely part of it.
Okay.
But I also had a great surgeon who took his time and prescribed the right surgery and did the right surgery, and then worked with me through physical therapy and coached me along the way and helped me get better.
Well, as I say, that's pretty young to have a spine surgery.
Yeah.
Right? I mean, you're probably an outlier type patient,
Yep,
correct? Yeah,
you're right.
So, that procedure, right? It was, so you had a herniated disc. Like, walk me through, what does that procedure
Sure.
entail?
So the procedure I had, it was called a microdiscectomy.
Okay.
And you hear people say, oh, I had a spine surgery at L4-5 or L2-3. So mine was at L4-5 on the left side.
Okay.
And
that's lumbar, right?
Yes,
lumbar,
in the lumbar spine. And so a microdiscectomy, the way that my surgeon performed it was he put a dilator down, made an incision in my back. I'm under anesthesia. Put a dilator down to my spine, which looks like a pencil.
Okay.
Just to separate the tissue. And then he puts a series of tubes, one bigger than the other one, on top of each other, and then pulls all the stuff out of the middle. And now he's got a nice tube tracked down to where the disc herniation is.
Okay.
And then he just puts his instruments down there with a light and pulls off the piece of disc, pulls out the piece of disc that was pressing on the nerve that was causing the pain down my leg.
I see.
And then removes it all at the end, sews you up, and you go to...
What's recovery time look like on that?
That's typically an outpatient surgery.
Oh, okay.
So you go home the same day. It's probably the most minor spine
Let's say, for all
surgery.
intents and purposes, you got probably pretty lucky, right? The
Yeah,
extent of the
yeah.
injury and the outcome of the surgery. So I've got a question here. What's your why? I don't need to ask
Yeah,
what your
that is
why
my why.
Clearly that's your why. But before we get to that, right? So I know there's a 17, 18 year period in between obviously starting Marvel Group. So what were you doing before, after college, after you realized you weren't going to be in the landscaping business? What was your career for that up to that point?
Yeah, so around the time I had spine surgery in my 20s is when I entered the medical field.
Okay.
I became interested as a patient, but I had probably a similar story to a lot of people who get into the spine business. I had a friend who worked for one of the major manufacturers who was also a business partner in my college landscape lighting company that I started.
Okay.
And when I was looking for a new opportunity, he sort of took me under his wing, and he started bringing me into the operating room and enter my old entrepreneurial spirit. I didn't want to go work for the big company, so I started carrying non-competing products to him.
Okay. So what do you mean by that? What non-competing products?
So he carried the sort of bread and butter implants of spine surgery, like the pedicle screws and the cages and things you may have heard about. And I carried a very unique endoscopic spine system.
Okay.
So it was an endoscope that's made for spine surgery. And at the time, Medicare wouldn't even pay for it. There wasn't a code for endoscopic spine surgery. So it was, I like to joke around and say I carried an endoscopic spine line before endoscopic spine was cool.
So you were like a hipster endoscopic
I was
spine
an
guy?
outlier.
Yeah. So before it was cool, man.
Yeah.
Well, so that would be meaning it was cutting edge at the time. That's why it wasn't even recognized to be covered. Okay,
Yep.
cool.
Since then, things have changed, and endoscopic spine is kind of like one of those new technologies that surgeons are employing at this point.
Okay. And this was what? How many years ago? 15 years ago, something like that?
This was, well, I'm 42 now, so I was probably 26 when I did that.
Okay.
It's been a while.
Yeah, man. And so that's got you into that business. So you're in the OR. You're helping with this complementary piece of the surgery, or like what was your role when you were in the operating room?
My role the first time I went in was just to keep my mouth shut and observe. It was kind of like
Try not to throw up, like seeing in blood and things like that.
Yeah, see if I could keep on my feet and just and absorb things and learn. And then as time went by, and I learned the ropes in the operating room, and I learned what the protocols were. And then I was able to pick up this, my equipment that I could sell and get a contract with the manufacturer. Then I began talking to surgeons and taking them to labs where they would be taught from other surgeons on how to do endoscopic spine surgery.
Okay. Well, it's a unique model to me. I've had some friends that are in the device space, right? Big companies like Stryker and sell things like that. It's an interesting model that I don't quite understand, where you have like this sort of third-party private company rep in the operating room. So tell me about that dynamic and like what their job is effectively, this guy that just standing in the operating room while somebody's cut open, like what's their job? Like what are they doing in there?
Yeah, that's a great question. So in spine surgery, and as well as some of the other disciplines, there's almost always an industry rep in the room. In some cases, there's more than one.
Really? Okay.
Yeah, and you as a patient, you sign a consent with the other stack of paper to say that that's okay. But their main role as a device rep is to make sure that you've got the right products in the room, and then to do the surgery that the surgeon does his style or his technique. And then I guess to back up before that, the main role of the medical device rep is to present these products to the surgeon, and then facilitate any training that may be needed, and then to make sure that those products are checked into the hospital a day or two before the surgery so they can be sterilized and wrapped. Then make sure they make it into the operating room, and then once the case has begun, make sure that the scrub techs and the nurses know how to put things together and have them in the right order, and then assist during the surgery to make sure that they're being put together right and in a timely fashion.
That's the wildest part to me, is like I know those guys have a lot of responsibility, and I understand there's a lot of testing, right? It's very stringent. You need to know your product, right? And if something goes wrong, you need to be able to advise. It's just a wild dynamic to me to think that like I was a carrier rep, so the responsibility, my job was to sell insurance, right? So now you got somebody whose responsibility is to sell a device, but also be able there with a physician whose job is to put it in to kind of guide them and help them through that. That's just it's an interesting arrangement, but obviously it works, right? And that they need to be there. Obviously, you've got to be a pretty smart person to be able to sell this and do those to support this physician. So you were kind of doing some of that, or
I was doing that.
You were doing that, right?
That's how I started my career.
Did you enjoy it? I mean, was that a cool career? Yeah.
Yeah, it gets a little old after a while because there's a lot of downtime and a lot of standing around.
Okay.
And that's not my nature. I like to keep moving.
Yeah.
But it's a great role and a great career path for a lot of people.
So where was then the recognition point that, hey, I wanted to do something else, right? So like we'll kind of enter into the Marvel group. Clearly there was probably some sort of eureka moment, right? That you had? Yeah.
So I've always enjoyed the business side of things. I like to read the Wall Street Journal. I like to read business books. And around the financial crash of 2008 to 2010, I became very interested in Warren Buffett.
Okay.
And speaking to an insurance guy,
Yeah.
I quickly learned that Warren Buffett makes a lot of his money from insurance.
And from float on insurance premium. Yeah.
And so I became very interested in insurance. And I had this newfound passion for spine surgery as a patient and then as an industry rep. And then on the business side, I was studying insurance and investment and float. And I just knew there had to be a way. I just had a hunch. There's got to be a way to put these two things together.
Okay. So was there a specific problem you set out to solve right away, or it was more a recognition of an opportunity, you thought?
Well, the specific problem came, the idea for that came when I was a patient and I felt a little bit naked. Like there's no warranty, there's no guarantee. As a matter of fact, when you sit down with the surgeon right before surgery, he spends his time telling you about all the risks. He's got to do this disclosure part. And there's really no counter conversation there. It's just there's a risk you may die. There's a risk this may not work. There's a risk of infection and so on.
But you're like, doctor, the idea is that I am actually going to benefit from
Yeah,
this, right?
yeah.
It's going to go well, right?
Right.
Yeah. Give me some reassurance, please. Yeah.
Yeah, and I had a young family at the time, and money was tight, and I was worried that I was worried that we would pay our out-of-pocket expense, and maybe I'd have to go back and do it again like 6 months later.
Yeah.
And so I saw an opportunity there. I didn't know exactly what it was at that time, but I knew that there was a problem there that could be solved.
Okay. And so it's just funny. One of the commonalities of entrepreneurs, I was telling you beforehand that I speak to quite a few, one of the commonalities is solving your own problem first, right? It's like, oh, I have this problem. And well, if I have this problem, if I could figure out how to solve this problem for myself, I bet a bunch of other people would benefit from me doing the same thing.
Yeah.
So you had a hunch that probably was the case too?
I had a hunch that was the case. And I also noticed that in healthcare, it seems like when you're working around physicians and physician assistants and medical device reps, they're in a pretty decent income bracket, right? And they don't typically worry about the same things that we worried about in the middle class, or even less fortunate than that. And so to me, I'm like, man, this is a really big deal for a patient. Nobody ever talks about the financial implications here inside the hospital. And it may have just been the group I was running with. I don't know. And I was the lowest paid guy, but that was a big deal for me.
I've been there myself. Yeah, I get that. Well, you were back to that point though. I think the stat is 1 in 5 Americans have like medical debt and collections or something to that effect. It's I hopefully I'm not misquoting that, but it's a significant portion of the population that can't even afford that $500 out of pocket expense or $1,000.
Yeah, actually, I think it's like 36%. There was a Kaiser Family Foundation article study recently released.
That's insane.
But yeah, and it was like 36% of the U.S. population can't afford an extra $400 a month in expenses without causing catastrophic issues.
Well, so that's where it speaks to the universality of your idea, right? Like if I'm worried about it being a sales rep that probably had a pretty decent income at that time, what is this like for a person that's on an hourly wage, or something to that effect? And if this goes wrong, am I going into bankruptcy or something to that effect?
Yeah.
And so thinking ahead, that's a pretty good recognition of a problem. So then, okay, moving forward. Now, what do I do about it? I've got this idea. How do I put it into motion?
Well, so the idea of having some kind of surgical outcome warranty always intrigued me.
Okay.
So I started talking to doctors, and the first thing I learned was in medical school, you learn as a physician that you never tell a patient that you guarantee an outcome.
Okay. I would agree with that, right?
I still get looks from doctors like, you must be nuts. What are you doing?
Yeah.
But I think it's an important distinction. We're not guaranteeing a positive outcome because we can't do that. Nobody can do that unless you're God. We're guaranteeing that if you don't have a positive outcome, but more specifically, if you have to go back for a revision in spine surgery, then we're guaranteeing to help cover their out-of-pocket expense associated with having to go back for that
So that's the
reoperation.
warranty component, right?
Yeah.
When we're talking about warranty. So why don't you, before we get too far, I don't want to put the cart before the horse. Let's describe Marvel Group. Like,
Sure.
give me the elevator pitch of who you guys are and what you do.
Yeah, so we're based here in the Dallas-Fort Worth Metroplex. My company is called Marvel Group, and we offer a surgical outcome warranty for spine patients, surgical spine patients, that is supported by our industry partners, so medical device companies.
Okay.
So we essentially take the high quality, latest technology, medical devices and biologics that are used in spine surgery, and we leave the manufacturer's warranty in place, and then when we add an additional surgical outcome warranty.
Okay. Oh, so there's a manufacturer warranty for, I guess, the device itself not failing,
Right,
or
if there's an FDA recall,
Okay.
something like that.
Gotcha.
And then we add our surgical outcome warranty to their product.
I see.
And the manufacturers pay for that. And in return, we also are collecting a lot of patient-reported outcomes data on those products, and we give that de-identified data back to the manufacturer in exchange for them supporting the warranty. And then the manufacturers can use that to improve their products and just understand what's working and what's not working.
That's interesting. So you give them aggregated but de-identified
Yes.
data back
Yeah.
to them. Okay. So when we say warranty, let me make sure I understand the terminology. Is that insurance? Or is it insurance, or does a warranty technically qualify as slightly different? Like, tell me about that.
Yeah, so CMS, the government organization that oversees Medicare, gets to make that call in healthcare. And
Okay.
They classify what we're doing as technically as a warranty.
Okay.
Not as additional insurance, but as a warranty.
As a warranty. And you say the device, the manufacturer is the one that is paying effectively for the warranty itself. In return for doing so, they're getting data.
They're technically, the manufacturer's paying us for the data, and we're issuing the warranty.
I see. Okay, interesting. Okay.
Yeah.
So, but the idea is from a patient, right? It's a patient, and ultimately you said is the first. That's the person that you're warranting on behalf of, is that patient gets to know that if something happens from a revision or a re-op, that I'm not having to pay out of pocket, correct?
That's correct.
Okay.
Yeah, and that we've skipped over that, but that's a revolutionary concept in our surgical stewardship program, is that the benefit goes to the patient.
I see. Okay.
It doesn't go to the hospital, it doesn't go to the device company, it doesn't go to the surgeon, it doesn't go to United Healthcare, it goes to the patient.
Okay. In what way then? Tell me about how it goes to them.
Sure. So if you needed spine surgery and you went to a surgeon that was enrolled in Marvel Group's surgical stewardship program, you had a spine surgery, there is a plethora of things that could go wrong within the first year. You could have a buildup of fluid. You could have a buildup of blood near your spinal cord that would require you to go back. You could have an infection that would require you to go back to the operating room. The hardware could break, and the list goes on. So if any of those things happen and you have to go back to the operating room for any reason within 1 year, and I emphasize any reason, including infection, because infection is our number one reason for return to the operating room.
Yeah, what percentage do you have that number that go back because of infection?
It varies by facility and by surgeon, which is something that we closely track. But overall, the surgeons that are enrolled in our program, with all of the reasons that they go back, we're trending around 3% of patients have to go back, which is well below the industry or the national average.
Do you know the national average off the top of your head?
That's a tricky question because it depends. There are varying degrees of spine surgery. If you go to, say, Ohio State University, where they do a lot of big deformity cases, their revision rate's higher because the patients are typically sicker and the cases are more complex, as opposed to a private practice spine surgeon who does mostly smaller degenerative type cases. They have a lower revision rate. But somewhere between 7 and 10% is where I would peg the national average.
Okay, wow. So you guys are significantly bringing that down because why? Because the quality of surgeons that are in your stewardship program, I presume? The
quality of surgeons, the quality of the devices that those surgeons use, and we call it our Pro Data Analytics program, which is our data collection program, which is a feedback mechanism for the surgeon.
Okay.
So if they have a revision, Why did that happen? It's a pretty labor-intensive process to collect the data that we're collecting, which is a pillar of our program, which we haven't spoken about in too much detail yet. But collecting that information for 2 years after the surgery and giving it back to the surgeon in real time,
Okay.
helps the surgeon identify what's causing issues, complications, and revisions.
Okay.
And then fix them.
That's the benefit then to the surgeon too, right?
Yeah.
I mean, at the end of the day, it's funny that a lot of this business is about the data that you can collect, right? And then it's not necessarily, oh, who can I sell this data to? It's like, what is the usefulness or what's the utility of this data in aggregate to make better decisions, make better devices, new techniques maybe that get introduced as a surgeon. So that's really interesting. I kind of didn't really think about that's part of the process. I was thinking more from the lens of warranting an outcome. But there's a lot more to it than just that.
Well, what's that old adage? If you can't measure it, you can't manage it.
Oh my God! I say that probably once a month on this podcast, and it's funny. It's one of my favorite phrases as well. I think we're kinfolk with landscape architecture now and phrases. But I'm with you, man. It's like that's part of the reason why I'm a big advocate of self-funding is because when employers self-funds, they get access to their own data finally. They can actually do something with that data. But if you don't have anything to go, well, where are my claims coming from or where are the problems? Well, then how can you ever make a change? You're just kind of shooting in the wind.
That's
right?
a great point. And that billing data that you provide back to the health plans is one set of data. And what we're collecting is a little bit different. So what we're doing is we collect data in 3 different buckets.
Okay.
Once you're signed up for surgery with the surgeon that's in our program, we will register you in our registry. And we've partnered with a company out of Chicago called Patient IQ.
Okay.
It's a software as a service. It's a cloud-based registry with a really powerful analytics platform attached to it. So you get signed up for surgery, and we will send you an email and register you in the registry, and you'll be asked a series of questions. Our first bucket of data we're collecting.
Okay.
And your surgeon's office will assist with some of this stuff. Like we're collecting ICD-10 diagnosis codes, just general demographics, protected health information, your name, your age, your BMI. There's maybe 25 data points we're collecting pre-op.
Okay.
That's not revolutionary. That's going on in a lot of places. But the next step is pretty revolutionary. Because we are working in concert with the medical device companies, we actually have access to the operating room. And the medical device, we call them clinical specialists. Most people in the industry call them medical device reps, are going into the operating room with an iPad, and we're collecting like 50 more data points.
Okay.
Like, who's the anesthesiologist? What anesthesia level? How much X-ray has the patient been exposed to? What was the start time of the surgery, the end time of the surgery? What was the blood loss?
So any variable that you can account for that you can then connect and go, oh, well, this commonality for this revision rate is because of this anesthesiologist, right? Or something.
Right, yeah. We're looking for those patterns. So basically anything we can see, smell, touch, or hear in the operating room, we're recording through an iPad in real time directly into Patient IQ.
Okay.
Then when you leave the operating room, at 1 month, you'll get a follow-up email or text from Patient IQ, and you'll get another one at 3 months. 3 months, 6 months, 1 year, and 2 years.
Okay.
We'll follow you for 2 years, and we use 7 different industry standard indexes that we didn't create. They're used widely throughout medicine, and generally, they're called patient-reported outcomes. I won't get into the different indexes that we use, but we're collecting follow-up information directly from the patient and then adding it to those other 2 buckets. So we've got a pretty holistic view with some really high-quality data, including for our industry partners, what implants were used, how much did they cost, what brand were they, what size were they, what side did they go on, and so on. I think we probably have the highest quality implant data in the country. We might have to edit that out, but
disclaimer. But the point is, right, is there's a volume of data that you're collecting, kind of. What would you call that? Like 360 degrees sort of around the surgery. But it's useful data, right? But it's not just to have it, right? It's measuring what are those consistencies of that you're driving towards a complication or a successful outcome ultimately is what you're hoping for. Right. So what are the commonalities that deliver a higher percentage successful outcome?
Exactly.
So can I go back as a patient? Am I aware of Marvel Group's existence, or what? Yeah. How do I know you guys are part of this equation?
You are. So you find out about Marvel Group when you are registered in the registry.
Okay.
There is a patient consent form that you'll digitally sign, and it won't. It doesn't actually say Marvel Group on the patient consent form. It says one of our affiliated companies, Surgical Services Group.
Okay.
Which is the medical practice that we spoke about, which actually issues the warranty.
Okay. And so then when I'm prompted to be aware of this because my surgeon is part of the stewardship program. Is that I'm connecting the dots there? Okay, cool. So it's only because I've selected a surgeon that happens to be in, do you guys call it a network, or what do you call this group of surgeons?
It's a network of surgeons that are enrolled in our surgical stewardship program.
Okay, awesome. And one thing I want to ask you, and I thought was really interesting, is you guys are organized as a nonprofit, right? Why? Like, tell me about that decision.
Yeah, that's more of a Texas thing. In Texas, well, let me back up. It's a CMS thing first, and then a Texas thing. So, CMS says we really want to encourage physicians to participate in value-based care, specifically value-based care coordination. There's a whole safe harbor around value-based care coordination. And then they very specifically say, but we don't want medical device companies to participate. Or let me say that differently. We want them to participate, but we don't want it to be their program. We want it to be run by physicians.
Okay.
And so we needed physicians and at Marvel Group to be able to offer this warranty. We needed to be organized as a medical practice. And so now to the Texas thing. Texas says lay people such as myself are not allowed to employ physicians.
Okay.
It's called the Corporate Practice of Medicine Law. And so in Texas, there's a special type of nonprofit that a company like Marvel Group can start that can engage physicians. And it's a medical practice. It's actually the same business structure that Baylor operates under.
Okay.
And so that's why we set up a nonprofit medical practice where we have physicians on the board making all the medical decisions, and then we have the business folks running the business side of the operation. And our physician board generally oversees our data collection program. So like, what data should we be collecting? How do we organize it and give it back to the surgeon in a format that he can use it to improve outcomes and reduce healthcare costs? And so we spend a lot of time with our board working on that piece.
Well, is there a philosophical component too of being a nonprofit that suggests that your incentives are aligned with the patient, that there's not a profit motive, I guess, if you will, driving these decisions?
Yeah. There is. When we didn't resist being a nonprofit, when we learned that was the path, it was something that we embraced.
Yeah, and it's not to suggest, right, that there's anything wrong with making a profit doing the service, right? It's just a lot of what our industry, and my industry more specifically, is that people complain because there are some situations where there's misaligned incentives. People are making an egregious amount of money, and it's almost money that's sort of hidden in the equation and dark money. So that intrigued me about the setup as a nonprofit, and kind of want to understand. And it makes sense now that you explained it a little bit further. What about I think the one thing that I want to understand is, where do you intersect with insurance companies, if at all? Like, are you having to prove things to a United Healthcare or a Blue Cross about these outcomes?
Well, we would like the opportunity to prove to United Healthcare and Blue Cross, but first we're starting with just putting the word out to self-insured employers, so mostly smaller to mid-size employers. That there may be a surgeon in your area that participates in this program, And we want you to think of that surgeon and his or her facility as a center of excellence, sort of like Walmart does with their centers of excellence around the country. Only specifically for spine surgery.
Yes.
Because that's our little corner of the healthcare world. So if you were to think of the way primary care is being talked about in the larger healthcare picture, we want the surgeons that we work with to be that care coordinator or that person, like a primary care doctor is for just the general population, but for those patients who have already been through the first part of the system and now are into this little corner of spine surgery. And we want the employers who are paying for this and the patients who are paying for that spine surgery to recognize that a surgeon that's in the surgical stewardship program is measuring his outcomes, is offering a surgical outcome warranty, and has some skin in the game.
Yeah.
And because he or she as a surgeon has more skin in the game than everybody else, because they participate in our program, they're incentivized financially to have positive outcomes and for the patients to not have to go back to the operating room, which unfortunately that's not the case in the general population right now. We're in a fee, for the most part, in spine surgery, we're still in a fee-for-service environment. And if we're both spine surgeons and you're really good and I'm really crappy, nobody knows because we both get paid the same amount of money and our outcomes are probably not being recorded or collected and published anywhere.
Yeah.
And so to the people paying for spine surgery, the employers and the patients, we look the exact same.
Well, that's just funny, right? You presume, let's say doctors on average are smarter than the general population. I mean, that's far a given. However, there's still a spectrum of abilities and intelligence levels and capabilities within that doctor. So how do you know your doctor wasn't the D student in the class in spine that just scraped by just to make it, and now he or she's your spine surgeon? And again, right, their competency level is still probably pretty high, but comparatively speaking to the people that get the highest outcomes, like you want to know that if somebody's cutting me open, putting a permanent device in my body or permanent alteration to my body, I kind of want to have a sense of their ability to do that well. Right. So are you guys, how do you track that on the front end? Like what makes a physician qualify to be in your stewardship program?
That's a great question. So if however the surgeon is identified or identifies with us, the conversation begins, and it eventually ends in this. If in order to participate in our program, you're going to have to go through a pretty strict underwriting process.
Okay.
Because although we issue the warranty, we offload most of the risk to a third-party commercial insurance carrier, and we utilize their actuaries and underwriting team to vet the surgeons out.
Oh, wow.
And of course they've got skin in the game too. So it's 3 years of case logs, and we're looking for the revision rate, basically, which is our one measure of success. And if for spine surgeons and other medical professionals listening, there's a lot that can go wrong that doesn't end up in a revision surgery.
Okay.
But we very specifically wanted our program to be simple enough for everybody to understand. There are lots of other programs out there that attempt to do what we're doing, but they're so complicated that even the surgeon sometimes doesn't understand.
Yeah, fair enough. Yeah.
So the surgeon's got to go through a pretty strict underwriting process before we can get them covered by our insurance carrier.
And roughly speaking, of every 100 physicians you look at, how many don't qualify?
I would say it's 1 in 10 we end up working with.
You do work. Oh, so 9 out of 10 don't.
Yeah,
you don't.
it's pretty exclusive.
You would, if you're like, yeah, we accept about 85%. You're like, well, hold on, are we doing
Yeah.
a decent enough job underwriting this? But that good. So it speaks to, hey, if I get access to, again, the presumption already is they're highly competent professionals.
Right.
Now we're taking the most highly competent of the highly competent, and those are the ones that are sort of allowed to be in that. And I like the fact that a third party is underwriting it, right? Because then there's less incentive for you to get more people in this network to kind of sell the product or sell the service.
Right.
You have them warranting the service, and they're the ones that are saying yay or nay. Right?
Yes.
Yeah. Okay. And they're taking the risk.
Yep.
Simultaneously. So that makes sense. So you have an independent third party that's essentially vetting their qualifications.
Yep.
Yeah. I love that.
Yeah.
And so out of that, so let's say that 1 out of 10 becomes a surgeon in the stewardship program. How does my job as a surgeon change, or what, if anything, about kind of my marketing or, you know, the network of people that come to me? Does anything change on paper once I become part of this program?
Yeah, typically we see a 30 to 40% increase in patients coming to that surgeon.
30 to 40%. Okay.
One of the things that the surgeon is very interested in is our surgical outcome warranty as a differentiator in his market.
So they're talking about it.
So they're talking about
okay.
it, yeah.
Okay.
And we've actually taken that to the next level, and through a third party, I mentioned him earlier, Feed, the agency out of Arkansas, has put together a surgical stewardship press release kit, social media content creation program, podcast. It's a program that they put together specifically for our surgeon customers, that our surgeon customers can go to Feed and pay for that themselves.
Yeah.
And use it as a community education tool.
Yeah, I mean, well, geez, if you were in that top 10%, why wouldn't you want to advertise your ability to have a higher quality outcome to the marketplace, right? I mean, that's a weird thing about this, and you know, I like things like cash-based pricing or, you know, bundled style surgery where you're effectively competing on price as a surgeon. There's a lot of different incentives for the physician to you know, market themselves that don't really act like the average marketplace acts. And so this is an opportunity for them to say, hey, I'm really good, or he or she say, I'm really good at what I do, come to me instead of the person down the road, right?
Yeah.
Yeah.
Yeah, and you know, the best way to reduce healthcare costs is to get the patients better again.
Yeah. Yeah, and fewer times they have to show up, right? I mean, that's the whole revision rate of why that metric is utilized. It makes a lot of sense because every single time they step in the door, it's costing the employer and the insurance company money.
Right.
Yeah.
As opposed to the more sort of common understanding of how to reduce healthcare costs is to grind the medical professionals' compensation down to zero.
Yeah, yeah.
We're taking a different approach. We want the data that we collect, we give, it's actually the surgeon's data. We've set our contracts up so that the surgeon owns the identifiable data.
Okay.
With the hope that the surgeon will use that information once he's accumulated enough, maybe 2 or 3 or 4 or 5 years worth of data, to go to the payers and say, look, here are my outcomes. I don't want another 5% decrease in my professional fees this year. I have superior outcomes to everybody else in the area. You should be driving your patients to me because I get them better, and they cost you less. It costs you less over the long run because they don't have to go back for revisions.
Yeah. Well, that makes sense, right? It's not necessarily like pay me less, like maybe pay me more, but it's because there's fewer touch points, right? There's fewer opportunities for me to charge or cost you money. So what about, I got a couple more, I want to ask so many questions, but you know, I want to make sure we keep this to the appropriate time frame. I have a couple main questions I want to ask. Let's start with the employer first, because I really want to understand the application for this. If I'm an interested employer or a broker who's hearing this and going, well, that sounds intriguing. How do I talk to my employer about this? Talk to me about the application to a group.
Sure.
How that works.
Maybe I could start with a question to you. If an employer enters into, let's say, a bundle program, and the bundle has a center of excellence where the patients need to go for spine surgery in order to facilitate the bundle, like, is it common that the employer will give the patient 2 choices? You can either utilize our PPO network or utilize our network, or you can go to this center of excellence where we have a bundled capitated price.
So I think you're going to have a mixed bag, and some will say you have to do this, right? And there's a lot of employers that say, hey, we're going to give you choice. I mean, there's companies out there like Zero Card, which will incentivize the member to make these choices by reducing their out-of-pocket costs or eliminating their out-of-pocket costs. So it's more so, hey, you're still going to have a choice as a member, but we want you to know go here, it's going to cost you X. Go there, it's going to cost you Y. Or you go here because this is a better rated surgeon or a better rated facility than here. You can still go here, but often they're disincentivized to go there. But if they still want to go to their trusted doctor or whoever they like, most employers will say, okay, you can still make that choice, but it's going to cost you more money to do that. Yeah.
That's what I was looking for. So
I hope I answered correctly. Anybody in the marketplace is going to be like, no, you're wrong, Spencer. But that's what I hear quite often is this: employers feel very concerned about being too paternalistic and telling them, no, you can't do that. So they just give them options, but they try to give them information to make the better choice, right?
So maybe if you're the patient and your employer is giving you that choice, you go to the Center of Excellence and you get your out-of-pocket expense waived. It costs you nothing. You go to the traditional network and it may cost you $5,000 or $10,000 out of pocket.
Right.
So if you go to the traditional network as the patient, and you end up with a surgeon that's in our program, you know two things. You're going to a highly rated, very qualified surgeon who measures his outcomes and can prove that to you. And two, that surgeon will offer you, or you're going to be offered through us, a surgical outcome warranty of up to $5,000 back to you if you have to go back for a reoperation for any reason.
Okay.
So now you've got a little bit better choice on that side. But on the other side, I still think you have a better choice as a patient. You go to the Center of Excellence that your company wants you to go to. They'll waive your out-of-pocket expense. So now you're not eligible for our surgical outcome warranty anymore because we don't want anyone profiting from going to surgery.
Sure.
We only want them being made whole.
Cut me open, doc.
But what's really happening to that out-of-pocket expense is the employer is absorbing it.
Yes.
So now we shift the beneficiary to the employer. And if you end up back in the operating room, the employer gets made whole because they're the ones that forked the money out in the first place.
Well, that's just it. Like I always talk about personal responsibility for the individual for their own health within the organization that they work for, because oftentimes that organizations might be paying 70-80% of their premium, and they're obviously sharing in contributions as well as the out-of-pocket expense. But if I'm making bad decisions, bad medical decisions, it doesn't just impact me, it impacts my employer, which what happens? It impacts everybody else that works at that company because my premiums go up or my benefits get stripped or both, right? So like having a proper incentive model that gets the individual to make better choices that not only benefit them, right? You want them to have the benefit, but the employer should also be able to benefit by driving these better choices simultaneously.
Right, I agree. I also think that our healthcare system is so complex that it's already been proven. Like some really big brains, like Buffett and Diamond and those guys, and Bezos, they tried to fix it, right? I don't think it's possible. So I think what we need moving forward are people who have a deep understanding of a little space, like I do of spine surgery in the spine business, and create a solution for that space. And
well, you know what you remind me of? I've had the CEO of Specialty Care Management on here before.
Oh, yeah.
And Specialty Care Management does what you guys do, except for dialysis. So they're kind of bucketing it over here and getting a center of excellence for dialysis and making it more predictable in cost and pulling them out of the fee-for-service model as well. And so why I bring that up is your point is take people that understand a specialty really well and come up with a solution for that particular specialty.
Right.
It's there when you need it. It's not a whole sweeping solution, but it's an opportunity. Oh, you got somebody that needs dialysis? Okay, cool. Here, we've got a solution for that. And it's sort of waiting in the wings to be applied. Yeah. I think your model is very similar to something like that.
Yeah, I think you're right.
Yeah. Well, cool, man. Maybe my instinct is correct on that. The one thing I do want the other question, I told you I had two questions. The other question I ask you, which is one, like maybe a lot of people are listening to this. This has come up before in the podcast. One of the common complaints about surgery in general is the necessity, right? About a quarter, 25-30% on average, guesstimated is unnecessary surgery. Whoever's coming up with that number, that's kind of a generally agreed upon rough number. Spine surgery is suggested it's much higher than that, right? So in this surgical stewardship program, what do you guys do with your physicians that are in your network to maybe prevent surgeries that are unnecessary? Because I think that should be part of the model, right? So is that a conversation these doctors are having that, hey, you're not a good candidate, or there's a better step before I cut you open? Like what tell me how you guys are addressing the necessity problem.
We're in a passive way, we're addressing it.
Okay.
because if the surgeon is and we are on the hook for the outcome, we know and he knows that operating on someone who doesn't need to be operated on is never going to end up with a good outcome.
Yeah, yeah.
so it's by creating that accountability.
Okay.
By offering, essentially by putting our money where our mouth is and offering money back guarantee on spine surgery, we're taking a calculated bet that will de-incentivize the wrong surgery.
Yeah. And that's all that, kind of wasn't getting at it. Not necessarily, you necessarily have to have the solution, but is the dynamic set up appropriately that there isn't an incentive just to continue to cut people open as many as possible, right? Because, I mean, if I'm in a fee-for-service model, I know every time I have somebody at my operating table, I personally make $15,000 or whatever that number is. That isn't something we want to avoid. And I think that speaks to why there is a suggestion that there is a very high percentage of surgeries that are unnecessary.
I'd be remiss if I didn't bring this piece up. So every year the surgeon has to go back through underwriting. We buy 1-year policies.
Oh, wow.
And we do that on purpose because we want to review the outcomes every year. So if a surgeon has less than optimal outcomes, he may make it through the first year, but we probably won't be able to renew him or her.
So you've had people that unfortunately had to be removed from the program?
We have not. Because we try to catch that on the front end. They're already great surgeons when we find them.
Well, they wouldn't be in the program in the first place, right? You just want to make sure somebody's not taking advantage of having that feather in their cap and then really not worrying about it after they got the stamp of approval, right?
Right. So it just doesn't make sense for the surgeons that we work with to do unnecessary surgeries because eventually it will catch up with them. They won't be able to get renewed in our program. And typically, by that time, they've already become known as the specialist within their specialty in their local community, and that would not be a good message to send out. That I'm no longer in this program.
Why are you no longer in this program? What happened? Well, so let's zoom out real quick. We got a couple minutes left, and I want to kind of go future of the surgical stewardship. I think one of the things you mentioned we hadn't come back to, which was off camera before, is you guys are in a pretty big growth phase right now. It's expansion. So talk to me about the future, short term and long term of your company.
Yeah. So short term, we're having a lot of success. We really just started heavily marketing our surgical steward. We started building it about 7 years ago. And we just started heavily marketing it about a year ago. And currently we're expanding into, we're already established in the Dallas-Fort Worth Metroplex with surgeons. If patients are looking for a surgeon here, in the East Texas market, in Columbus, Ohio. And we're currently expanding into Nashville, Tennessee, and the New Jersey, Philadelphia area. And then, of course, my favorite expansion is my hometown of Dayton, Ohio, which is something I'm really proud of, to be able to bring this back to my hometown.
Well, especially you get the excuse probably to travel back there more, right? Which, you always can use that excuse. So as you scale, and as you broaden this across the country, does it change the model, or is it just about repeating the model but understanding the local kind of idiosyncrasies, if you will? As
we scale, it's just about repeating the model and refining the model. But what I see for the future of surgical stewardship is what I would like to see is having a surgeon presence in every city in the country. And I'd like this to become the standard of care in spine surgery. And my gut feeling is it will. It may take a little while, but since we've launched our program, we've already been contacted by all of the major manufacturers in spine and even in orthopedics for knees and hips.
Yeah, there's no reason this couldn't apply to other types of surgeries, right? Yeah, okay.
And we're getting a consistent message from these, multi-billion-dollar device companies saying, well, we've been trying to figure out how to do something like this for a year or 2 or 3 now. How did you guys figure it out? And we're a little guarded with the details because we want them to work with us.
I was going to say, I could ask you the question, why are you guys so unique? But probably maybe better not to publicize that. But, clearly you guys have done something right, which is you're getting on the radar of these people. And I was just not thinking about this. Why hasn't this been done for knees now and then hips and, other brain surgery? Maybe that one's a little too complex. But, this could be repeatable for most orthopedic style surgeries, right? So it's the expansion really. And then do you think it evolves contractually? Do you think there's other things that could evolve to make it I don't know, maybe easier to set up in a new location quicker, right? I think some that's part of the refining process. Is just,
Yeah. In medical device, there are these things called group purchasing organizations that control a lot of the purchasing spend for medical devices, which is what we use to support our program. So I think eventually the large GPOs will learn about us and reach out to us, and we have not been on the offense to try to talk to them. We're busy just trying to keep up with our internal growth right now.
That's awesome.
And I think eventually some larger money will come along and want to participate in this and help with the expansion too.
Yeah. Well, keep doing what you're doing, man. It sounds like you guys are obviously at an inflection point, which is really fun to see. So closing thoughts, Jamie. I know we've been talking maybe about an hour. Kind of anybody that's listening here till the end, what you want to leave the audience with?
Yeah. If you've listened this long, you should probably go to our website at marvelgp.com and learn a little bit more about the details, and follow us on LinkedIn as well. We'll be posting hopefully some of this podcast.
Oh yeah, definitely. Yeah,
LinkedIn.
so you'll have carte blanche to post as much of this as you want and cut it up how you want. You've got your marketing guy. Keep doing what you're doing on LinkedIn, because literally that's how we got connected, and I think it's a really great way to advertise to a core group of professionals that could put this in motion, right? So continue to mine that as much as possible, and I wish you success, man. And thanks again for making the trek from Southlake.
Thanks, Spencer. I appreciate your time.
Take care, man. Bye.